Surrounded by the Green Ridge, in the heart of India's capital city, Delhi, stands tall the historic Ganga Ram Hospital. It is a multi-speciality, charitable, 650-bed private healthcare facility. A leader in the industry, the hospital is a pioneer in setting national healthcare standards. Its goal is always to bring together diverse medical disciplines, all within one single premises. An engineer with Imperial Engineering Services, Sir Ganga Ram, a legendary philanthropist bestowed with a knighthood by the British Empire, founded Sir Ganga Ram Hospital at Lahore in 1921. After partition, Shri Dharam Veeraji, grandson-in-law of Sir Ganga Ram, relocated the hospital in Delhi. In 1954, it was inaugurated by late Pandit Jawaharlal Nehru. Since then, there has been no looking back. Over the years, hospital has created milestones in healthcare and pioneered the employing of latest in global medical technologies. It developed unique hospital managed practices, adopted and replicated by innumerable hospitals throughout India. Its achievements were made possible because of the competence, integrity, and excellence of consultants and staff. Accomplishments become a concrete reality because of the unflinching support of Sir Ganga Ram Trust Society. In the last 10 years, under the chairmanship of Padma Shri Dr. S.K. Sama, the hospital grew from a mere 10 crore rupees turnover to a rupees 144 crore healthcare giant. Today, Sir Ganga Ram Hospital is a paradigm of excellent medical care at an affordable price.
Our commitment is to have dedicated doctors, nurses, and other medical staff of a high standard who, with the help of the latest diagnostic and other equipment, will offer to patients physical, mental, and humane health care and treatment in a comfortable, caring, and safe environment at affordable cost. Always bearing in mind the overriding objective of the founder to provide free treatment of equal quality to an ever-increasing proportion of the poor patients.
Some of the services and features the hospital puts on offer are comprehensive medical cover provided in around 50 general and super specialty branches, 650 inpatient bed capacity, 120 world-class critical care beds, 20 seamless operation theatres and twin cardiac surgical operation theatres, 16-bed cardiac surgical intensive care unit, 44-bed medical and surgical intensive care unit, 26 neonatal intensive care beds, 7 pediatric intensive care beds, 18 high dependency unit beds, 5-bed thalassemia unit, 13-bed dialysis unit with a separate 3-bed unit for hepatitis B positive patients, 7-bed joint replacement center, online medical tracking system, and a world-class hospital information system. Inaugurated in 1999 by President K.R. Narayanan, Dharam Veera Heart Center at the hospital offers the latest of cardiac technologies. It has the facilities for executing most complex of diagnostic tests and about 1600 angiographies, 380 angioplasties, and 580 cardiac surgeries are performed annually. Minimal access surgery department at the hospital is a center of excellence in laparoscopy. It has performed over 26,000 laparoscopic procedures and features in Limca as well as Guinness Book of Records. It has the honor of operating on His Excellency, former President of India, Shri K.R. Narayanan. It trains over 1,500 surgeons from India and abroad annually and is acclaimed for producing one of the most practical books on endohernia. Premier Therapeutic and Surgical Gastroenterology facility at the hospital has the distinction of performing the first endoscopic suturing for reflux esophagitis in the world, the first biliary therapeutic endoscopy in India in the private sector, and the very first reduced liver transplant in the country. It is the first hospital in India to implement strict sterilization and reprocessing of endoscopes, having executed more than 1,200 kidney transplants. The hospital has an enviable reputation in this field. It runs a state-of-the-art multi-organ transplant center, expanding the much-needed and urgent scope of organ transplantation procedures.
हाँ, मेरा नाम दशरथ प्रसाद पाल है। मेरी बच्ची कुमारी चांदनी पाल का लीवर ट्रांसप्लांट सर गंगा राम हॉस्पिटल में दिनांक 4 जनवरी 2005 को 9 वर्ष के आगमन पर हुआ है। यहाँ लीवर ट्रांसप्लांट से जुड़े सारी यूनिटें जो है काफ़ी अच्छी लगी मुझे। डॉक्टर साहबान जो हैं, नर्स वगैरह जो हैं, पूरे स्टाफ जो हैं बहुत अच्छे लगे। काफ़ी तारीफ़ के काबिल हैं। इन्होंने काफ़ी हमारी मदद की है बच्ची के जान बचाने में।
Building upon its excellence in orthopedics, the hospital provides a dedicated joint replacement unit. While providing services like total hip and knee joint replacements and others, the hospital also provides highly satisfying results in pediatric orthopedics. Hospital is the largest provider of integrated fertility services in North India. Its in vitro fertilization center has the first test tube baby of the region to its credit. It constantly invests in the latest of technologies and reflects a success rate to the tune of 35%, which is amongst the very best in the world. Neonatology department of the hospital has the first neonatal intensive care unit in Delhi to offer total medical solutions for the newborn. It is a pioneer in starting mechanical ventilation for infants in the private sector and is the first to offer neurosurgery for infants along with the facility for neonatal ambulance. Some of the best blood transfusion medicine services are available at the hospital, with facilities like blood component preparation, apheresis by cell separator, and even harvesting of peripheral blood stem cells. Its services rank amongst the very best in country. Nuclear Medicine Center at the hospital is the first in the region to offer instant vertebral assessment, allowing the doctors to do a spine scan within just 10 seconds. It is also the first to have revolutionary Delphi bone densitometer and to offer radiation synovectomy, immensely useful for patients of rheumatoid arthritis. In 1983, the hospital instituted the first private sector CT scan center of Delhi. It carries out approximately 10,000 to 1,10,000 scans every year and has facilities like workstations, server for teleradiology and documentation on CD-ROM and film. The center also conducts about 8,000 MR scans every year, and the highly competent consultants have already delivered 2,000 guest lectures. Sir Ganga Ram is the first non-governmental hospital to provide maintenance hemodialysis in North India. It takes pride in its provision of total services in maintenance hemodialysis for the patients of renal failure. It performs more than 1,200 dialysis every month and is the first to have reverse osmosis water treatment facility for all its dialysis processes. It is the first hospital in North India to have an independent department of vascular surgery. The department is the only one in India to offer laparoscopy-assisted vascular surgery and is the first to run a swollen leg clinic in North India. In neurology, the hospital is the first in private sector to have movement disorder clinic that uses botulinum toxin. Most comprehensive stroke facilities are available, dealing right from acute thrombolysis in ischemic stroke to carotid endarterectomy for secondary stroke prophylaxis. Besides the cultures of blood and body fluids at its microbiology center, hospital has the state-of-the-art 3D BACT alert system that allows automation for tubercular culture and sensitivity. It offers molecular diagnosis of diseases like cytomegalovirus, hepatitis C and HIV through NASPA technique and is involved in many important research projects, including some from WHO. The hospital has one of the leading genetic medicine facilities in India. It provides genetic counseling to about 3,000 patients annually and has the most comprehensive prenatal diagnostic program in the country. It is one of the most advanced centers for molecular diagnosis of genetic diseases and has been listed in Limca Book of Records for pioneering work in genetics. While the hospital started in 1954 as a small community health center and grew from strength to strength, in July 2004, it made another leap. A new super speciality and research block was inaugurated by our Honorable President APJ Abdul Kalam. In its new block, hospital offers the very latest facilities in modern critical care medicine. The ICUs are a centrally climate-controlled premium 44-bed facility. Cutting-edge equipment like airway management system, resuscitation units, ventilator supports, continuous drug infusion units, invasive output monitors and others are readily available. An online tracking system is in place, feeding directly into a world-class hospital information system. 20 high-tech modular operation theatres in the hospital are equipped with a range of checks and balances, making them an almost 100% bacteria-free environment. These employ the most sophisticated add-on equipment, which makes them internationally competent for any operating situation. In the same building are housed hospital's benchmark laboratories. These labs at the hospital are some of the very best in the country and enjoy an extremely good scoring through external quality control programs like RICWAS of United Kingdom. The lodging facilities at the hospital are committed to ensuring the most comforting of stay for its patient guests. Highly personalized attendance is provided by a set of dedicated staff. Hospital is steadfast in providing a quality stay with the right mix of compassion and care. Hospital incorporates some of the best infrastructure support. It has a highly automated sterilization and medical waste management system with facilities like two-tier parking, souvenir shops, cafeterias, and others. Regular investments are made to create a plush environment for the visitors to feel at home. With an increasing appreciation of alternative medical systems, hospital wholeheartedly embraces the virtues of holistic healthcare. It already runs specialty clinics in acupuncture, homeopathy, and yoga, while there are plans to start facilities in naturopathy and herbal medicine very soon. Hospital believes in the care of soul along with the care of body. It regularly organizes sessions with spiritual masters at its own premises and outside for the spiritual enrichment of the masses. It does charity work to the tune of Rs 100 million annually. Annually, a lakh of free investigations are done. 20% of the hospital beds are already earmarked for the poor. It runs community health clinics in rural interiors, bringing modern medical treatment and consultation to the doorsteps of the underprivileged populace. Hospital runs a separate research and academics department. It successfully runs Diplomate National Board programs in 24 medical and surgical specialties, as well as postdoctoral fellowship training in 5 super specialties. It is a recognized center for FRCS Part A and B final examinations conducted in India by Royal College of Surgeons, Glasgow. A highly credited diploma program in nursing is also running successfully. Indian Council of Medical Research recognizes the hospital as a research organization, and the hospital serves as an important research center for esteemed institutions like WHO and many others. All the academic rooms are well equipped with computers and multimedia facilities. A well-stocked library is diligently run to further generate and share scientific knowledge and medical experience both nationally and internationally. The society and medical fraternity around the globe recognize dedication and quality of services at Sir Ganga Ram Hospital. It has on its rolls an internationally recognized faculty of talented medical consultants with laudable contributions and awards to their credit. Both the humble populace as well as a range of celebrities flock to the hospital for medical care and become its speaking testimonials. A global healthcare destination, Sir Ganga Ram Hospital stands committed, tireless, in the service of humanity, day in and day out.